This is the Tom Anderson Show, broadcasting live from the KVNT studios, 7 to 9 a.m., Monday through Friday.
Alaska's state pharmacist Coleman Cutchins joins us, and an appropriate time to dialogue on COVID-19 cases. I mean, we're in the latter part of August 2021. There is misinformation abound. Coleman, my hunch is that you are really on the job nonstop, day after day after day. There's really no relent or break because of misinformation that we're seeing in the news, more so on social media. Good morning. Thanks for joining us. And let's just get into it. How are you countering such, whether it be nonsense or by design, misinformation to lead people a different route than healthcare safety?
Hey, Tom, thanks for having me on this morning. Yes, unfortunately, the whole pandemic has really been almost a misinformation pandemic as much as a viral pandemic. Going on calls like this, we have a lot of outreach, doing a lot of speaking to groups, and pretty much been 24/7 for over a year and a half now.
Let's get into your background so people understand. I won't treat it like a trial. First, we'll have the expert witness give his resume, but I'm going to do that. So you're a pharmacist, but explain what your background is, your credentials, and then how you got the state pharmacist job. What is that?
Thanks. I'm a board-certified clinical pharmacist, so I always tell people I'm the pharmacist that's never worked in a pharmacy. Clinical pharmacists are more medication and therapeutics experts. We prescribe meds. We act very similar to what you would think of a physician doing, but we're not experts on diagnosing. We're more experts on treating. So, very much, medication experts. Spent most of the last decade of my life as an infectious disease clinical specialist here in Alaska within the Providence system. I've also worked internal medicine before that. Years ago, I did drug research at Vanderbilt. So I have a lot of experience too in drug trials, research, things like that. I actually came over to the state December of 2019, right before this pandemic broke out. So I was actually initially brought on to work on opioid epidemic, but then when the pandemic broke out, it fit my skill set, and I jumped onto the senior medical leadership team right when we declared our emergency declaration.
Yeah, and Zink, Dr. Zink, who we've had on the program, and Commissioner Adam Crum, and you, Coleman, you all chose a really fun time, and I say that tongue-in-cheek, to join the state healthcare system because we have really had our work cut out for us, whether we're in radio, we're in business, we're just a day-to-day citizen dealing with this. I can't imagine the stress you have all had, and I give you great not just gratitude, but compliment for how you have done it. The numbers and the statistics are positive, and yet right now, when you go to ADN.com or Alaska's News Source, or you look at Coastal TV in Juneau, wherever, Fairbanks, the ICU numbers are up. That is primarily because of the Delta variant, correct?
Well, the surge in cases is largely driven by Delta, but I think it's a lot of factors. Now, when you talk about our ICUs being full, as we all know in healthcare in this state, we have limited healthcare capacity. Our hospitals operate at close to capacity all the time, year-round, without a pandemic. Things like flu outbreaks and things like, big unfortunate car crashes on the highway can overload our healthcare system already. That's been really the biggest concern, or one of the biggest concerns for a healthcare capacity system in this state through the whole pandemic. Is we don't have a lot of extra capacity, and we're not close to other people to be able to easily fly patients. I've been in Alaska for almost 14 years now. Prior to that, when we were in Tennessee and I was at Vanderbilt, there's a whole lot of hospitals, easily transferring patients around. Here you got to go a few thousand miles to get to Seattle or Portland, and that's only in one direction. So we don't have a whole lot of extra capacity. And we know when hospitals get overwhelmed, we get worse outcomes for the other things that happen, like car crashes and strokes and heart attacks and, the things that are unfortunately happening to people all the time anyway.
Friend of mine in Anchorage just got his COVID test result negative, and he went to get that test result, went to Capstone, one of our sponsors, and he did so because he had flu symptoms and was a bit nervous, and his physician ultimately said, hey, you have the flu. Is that a surprise to you, or is that something people should be cognizant of and very much a reality that beyond COVID-19, the flu is back?
Everything I'm going to tell you is not political. Unfortunately, there's so many political things that have been, polarized through this pandemic that really aren't. Some of the practices that we've kept, distancing, masking, things like that, have protected us from the other viruses. I can honestly say, as a parent of an 8th grader and a 10th grader now, this last year was the first year that nobody in my family was sick. And a lot of that was due to the fact that, masking, distancing, washing our hands, avoiding gathering helped prevent the flu. It helped prevent colds. It helped prevent, stomach bugs and kind of all this other stuff. So, unfortunately, we are back to that time of year where we have other respiratory viruses circling, and we're starting to see some cases of flu. Here in the last month, us as well as a lot of the places in the lower 48, we're having a lot of cases of RSV, which is a virus that can severely affect young children. It's that time of year again, so not surprising.
Well, you mentioned 10th grader. I have a 10th grader as well. Personal question, did your 10th grader get the vaccination? My son did. Went to Capstone here in the Valley at Sears and got both the Pfizers. Are you one that supports that?
Yes. I will say in terms of vaccination, one of the things that's really been a personal, saddening through this pandemic is the fear of vaccination. I kind of go off a tangent here. So when we think about our drug approval process here in the U.S., we have the stringent and the safest drug approval process in the world. Vaccines go through that same process as do all of our other drugs. Our drug approval process here in the U.S. is based on 2 pillars. The drugs have to be proven safe and they have to be proven effective. These vaccines have gone through that process. They're not experimental. They're not investigatory. They went through all the process. They just sort of get a fast pass to go to the front of the line. So I will say, before the vaccines received EUA approval, I was kind of neutral on the fence, like, hey, yeah, I'm definitely going to get the vaccine for me if they get approved by the FDA and the data shows that they're safe and effective. I was honestly never really concerned about safety because vaccines are the safest class of drugs that we give to a large number of people every year. Vaccines have saved more lives over the last couple hundred years than any other drug class we have. Diabetes drugs, insulin, heart drugs, antibiotics, these have saved more lives than anything. Vaccines are also one of the most natural drug classes we give. They don't change your cellular mechanisms. They don't block receptors. They don't block pathways. They basically train your body to do something in the future. They're only in your body for 2 to 3 days and they're gone. So it was a very easy decision for both my 13-year-old daughter and my 15-year-old son. Talked it over with them. They actually were ready to get the vaccine because, having 2 parents in healthcare, they understand that vaccine is the way out of this pandemic. So they both got their vaccine on the first day that it was authorized. I have many other physician friends that also got their kids vaccinated on the very first day. So yeah, no hesitation there.
Yeah, my 15-year-old son is the same age as yours. He doesn't love shots, but he said, I'll do it. And then in both cases, he said, wow, that has to be the smallest gauge needle. It was like a mosquito bite. It was not painful at all. And after the fact, there was no problem. Yes, we've heard stories where there have been some, there's been discomfort or maybe someone didn't feel well. When we come back, Dave Sterin helped set this interview up. I think you can stay 2 segments. We're talking with Coleman Cutchins. We're going to make a YouTube video of this as well. So you can go to the Tom Anderson Show YouTube page and you can listen to the video and you can contemplate what he is talking about. He is the head pharmacist for the state of Alaska. I want to get into not debating, because I pretty much agree with you, Coleman, the conspiracy theory elements. I'm not going to justify them or go down that road, but I want to talk about why you think, like someone says, well, the WHO says this. The federal government says this. There's one statistic here and it may not comport with another statistic. I think media and conspiracy theorists fuel the fire of discontent and discord. I think that we're not always getting all the statistics, and I think that causes people to raise an eyebrow. And if that didn't happen, more people would get the vaccination. We'll get your take on that. Also, had a friend at a lodge who thought he saw COVID earlier, and I'll tell you that story and get your response. Stay with us. Tom Anderson Show.
This is the Tom Anderson Show, broadcasting live from the KVNT studios, 7 to 9 a.m., Monday through Friday.
Well, from Rasmussen.org, Rasmussen Foundation here in the great state of Alaska, I'll read an excerpt. Pharmacist Coleman Cutchins joined the Public Health Division in Alaska in fall 2019 to work on decreasing opioid abuse. Then came coronavirus. He began helping to prepare hospitals and communities for an expected spike in cases. He worked on treatment protocols, guidelines, surge plans, even transfer agreements. When that work was handed off, he became more involved in testing and has been affectionately named the testing czar. Ann Zink is Alaska's chief medical officer, Dr. Ann Zink, who's been on the show, and she says Coleman always has an eye for problem solving. Never seems to get flustered, calmly and efficiently continues to build out testing around the state of Alaska while at the same time keeping an eye on all pharmacy-related literature and treatment options as this pandemic progresses. Coleman, you're not Coleman Cutchins, you're Superman. I'm proud of you. That's a great excerpt on your biography, and it sure seems accurate. We were talking about testing, vaccinations, your and my kids getting it. We're supportive of this. For the break, I talked about, because I do the morning news every single morning for 10 years now, you know, the World Health Organization, Dr. Fauci, now everybody knows that name, Rand Paul, U.S. Senator, the ophthalmologist from Kentucky, you know, Trump versus Biden versus political extraordinary all across the nation. We hear from media sources, from social media, sometimes conflicting reports, but it breaks down into statistics. You highlighted vaccination efficacy and how it's done. Sometimes it has to be fast-tracked. It can't be instant or people are going to die and succumb to COVID or whatever the malady is quicker. Do you put any merit in this broader speculation that, we have conspiracies with global efforts versus local versus pharmaceutical companies, or would you say that's just hype from people who need to get a life?
Yeah, I mean, there's a lot of conspiracy theories. I mean, so I think it's heartbreaking to hear the mistrust of the vaccines because of the monumental lift that it took. You know, and it was also a partnership between the previous administration and the current administration, you know, at the federal level. All politics aside, you know, the monumental lift that it took to develop these vaccines in a safe and effective manner, roll them out and distribute them. You know, we're at last I checked, 370 million doses here in the U.S. And to put that into perspective, you know, that's more than triple the number of the top prescribed drug in the U.S. a year. So we've got, you know, essentially 3-4 years worth of data on these vaccines now, which is why, you know, there have been some rare, you know, 1 in a million type side effects. Those type of side effects and events always come up when drugs make it to market. You never study drugs in clinical trials in more than tens of thousands of people. So these rare events, you know, like the rare clotting events with Johnson & Johnson, the rare event of mild myocarditis with the mRNA vaccines, these 1 in a million type events, only ever come up. And that's why we've been transparent about them. You know, but overall, we can safely say at this point, the risk of acquiring the virus greatly outweighs any risk associated with these vaccines.
A friend of mine, a couple from Europe, have a lodge in Alaska, and he was telling me a story this summer about September 2019 had, I believe it was September 2019, had guests, and he was talking about the fact that after they left, he was very ill, and he believes he had COVID. And I said, why do you believe that? He said, Tom, I had all the symptoms. I couldn't smell, you know, sense, olfactory, couldn't taste. lethargy, all the things, and it was bad, and I was worried. Like, I've never had a flu like this. And he said, dollars to donuts, I bet you I had COVID. And I said, well, that's a little premature because of the timeline. And he said, well, guess where the people were from? I said, where? He said, Wuhan, China. They were Chinese. I'm like, serious? He said, yes. Do you think I know you haven't studied or researched that, but is that possible that early COVID was here?
I mean, is it possible, given that they were from Wuhan? Possibly. Our earliest known cases were a little bit after that. The other reason I hear a lot of reports about people thinking that they had COVID, at an earlier time.
But not with Wuhan Chinese friends there.
I guess that makes it a little bit more likely, but I still think it's not as likely as you would think. I will say that there are other viruses, common cold viruses, that can make people severely ill. And, my time working in acute care hospital in infectious disease, I can count, a half a dozen or so people that had a very similar syndrome and passed away over the last 10 years, but, really small numbers. You see one patient, one or two here and there over the course of the winter that end up, in this severe, respiratory distress type syndrome, prone on a ventilator on high flow oxygen, very similar to what we see in the severely ill COVID patients. Other viruses can cause that, but it's very rare. Nothing like the incidents we're seeing with this virus.
Which makes sense. You can't speak for Providence, where you used to work, or the hospitals in Alaska. I recognize that. But as the state pharmacist, you certainly work with them. And when you hear folks talk about ICUs, and some say, raise an eyebrow, conspiracy theories, we get some of the calls saying, hey, the ICUs, they're closing off some, the numbers aren't accurate, this, that. I don't buy that at all. I think when Providence says, hey, we have this many ICU beds and this many are full, I have friends that are nurses there. I think it's real, and I think the shortages are real. You and I can't read the minds of nurses or staff, why they don't come to work, what the beef is, if there's been an issue, an argument on pay or overtime. Who knows? And you I would assume, don't know that either, but we both are logical and rationally based thinkers, and when we hear statistics from Providence management, that's very real, isn't it? ICU beds full across the state and a shortage of staff.
So the bigger factor there, and I'm just going to be totally honest, is shortage of staff. This is a difficult state to recruit healthcare workers to anyway. We never have had, at least in the time I've been here, we've never really had an excess workforce of, doctors and nurses and physical therapists and MAs. It's just, we don't have an excess workforce, and it's hard to recruit people up here. So right now, the limiting factor in our hospitals isn't necessarily the beds, it's the staff to provide care for the people in those beds. So even if a hospital may have more, just theoretically, and this is happening, a hospital may have more open beds than they can staff. Yeah. So it's not necessarily open beds, it's staff to take care
of them, which makes sense. By the way, I have a question. More so, entertain the notion that you would shout out these healthcare providers like Capstone Clinic. They create COVID Secure. Dennis Spencer, the CEO, Dr. Wade Erickson. I know you've worked with those two gentlemen and their staff. They've received contracts for state airports and such. Has it been a pleasure to work with folks like Capstone, entrepreneurs and healthcare providers like you were when you were in the private sector that have stepped up and tried to at least suppress the spread of COVID through their systems?
One thing I will say, it's been a tough year and a half. But what really has kept me going through this is, the ability to contribute, to be here for the state of Alaska, to be here for their people. And I really feel like a lot of people have done that. Capstone definitely has, other contractors definitely have, our hospitals have, our clinics have, frontline workers, people that support our critical infrastructure, people that support travel. It's been a really positive experience seeing people from all these different backgrounds come together and do the right thing to help support our state, to help support the pandemic. So now the thing that we're really, in my mind, that really needs to do is we're there with vaccines. I'm not going to specifically say, hey, you have to go out and get vaccinated, but if everyone in this state who's not vaccinated made it the choice today to go out and get vaccinated, couple months from now, the pandemic would look very different. You know, if everyone had made that decision 2 months ago, we wouldn't be in the place that we're at now with Delta.
There you go. Coleman Cutchins, he's our state's pharmacist. It's such a pleasure to have you on, Coleman. Hey, endearingly, they call him the testing czar. Heed his words, folks. He means well, and it's saving lives. Get tested, get your vaccination, and enjoy your weekend. Tom Anderson Show.
This has been the Tom Anderson Show, broadcasting live on KVNT 1020 AM and 92.5 FM, Alaska's conservative talk. Listen to Tom Monday through Friday, 7 to 9 a.m. Online at tomandersonshow.com. Enjoy your morning and keep it tuned right here on KVNT for our all-star talk show lineup.